about policy. Um, Next slide, please. Don Louise is joining us from Sickle, and she's going to help me with advancing the slide. Um, a little bit about Sickle for those of you who are not familiar with the organization. Sickle is a national sickle cell disease advocacy organization whose mission is to elevate the voices of the sickle cell disease community and our stories of resilience. Our vision is to influence decision makers and propel positive change for the sickle cell disease community. I think it's really important to understand what Sickle Cell's focus is and what grounds us. Um, the organization was founded by Ashley Valentine and her brother Marcus, her late brother Marcus. And so we continue on in his honor. And as an individual living with sickle cell disease, it's a pleasure to be a part of this organization. Next slide, please. So, what is the sickle cell disease policy landscape in 2026 and where are we now? We've got a lot going on. Next slide, please. So let's talk about why your voice matters as we dive into what the policy landscape looks like. So right now, there's a lot of change going on in Congress, and there's a lot of change going on in the sickle cell disease landscape. And most members of Congress actually have little insight into what it means to live with sickle cell disease, and not just Congress, also some of our federal partners as well. And so it's really important for policymakers to hear our stories to help bring policies to life. And what's most important is your voice and the need for your voice to help inform the decisions that impact healthcare quality and access. Data collection is a big area, and we'll talk about that a little bit more, and to help influence what the research priorities are. And we also have some key priority areas when it comes to that research and what you can talk about. And these individuals may be elected officials, but truly you are the experts in this work. And most of the time, engaging with elected officials, they will recognize and acknowledge that the voices of the community are what anchor the decisions that need to be made. Next slide, please. Um, what are we hearing about sickle cell disease? What are worrying people? And I'm sure this is just capturing a snapshot, right? And the cuts to Medicaid have been very real and active discussions, and people are concerned about how those funding changes may impact their care. We're also understand that there's increased state pressures, restrictions in eligibility as a result of funding constraints, tightening utilization controls, and that's just around how much people can use the healthcare system, and delays or denials in coverage for certain therapies. And some of that is just a matter of being able to put certain practices into place for these new therapies that are coming onto market. And loss of protections that stabilize access to specialists like your hematologist or seeing your ophthalmologist, pain management, and long-term disease modifying treatments. And so the landscape is evolving, and there's an opportunity to bring education from your voice around the importance of what some of these concerns are. Next slide, please. Um, the big beautiful bill. It's funny how much happens so quickly that some things start to feel a little bit like old news. But something that did happen is the big beautiful bill, and it is still moving forward. And impacts of the big beautiful bill include reductions in federal spending, some restructuring in how Medicaid works, and shifting more of the responsibilities to states. And where there may be some challenges in that, there still may also be some opportunities. I think the most relevant one to note here around the big beautiful bill is that the requirements to Medicaid are to go into effect in 2027. States are actively responsible for informing the federal government around how they will put certain requirements in place to align to those federal guidelines. And those specifically are focused around work requirements. And so there still are opportunities to influence what that looks like. And that's really important as you're advocating. And that there are no changes to work requirements on the Medicaid level that have gone into effect yet. Those are intended for 2027. And while these details continue to evolve, patients obviously are reacting to what we anticipate is going to happen. And so that is understandable. Next slide, please. Um, so most people with sickle cell rely on Medicaid. A little over 50% of them do. Sickle cell disease care is oftentimes um, it's long term. It's for life. For the most part, it has a lot of high touch in it. So it needs individuals with sickle cell need a lot of care, and it's not easily shortened. And so normally the quick answer in the healthcare system is like, can we solve the problem to help bring down costs? But this is a lifelong chronic condition, and so you can't, shorten the impacts. They're ongoing. Um, and the challenges here with that is that a lot of policies are designed for cost savings, and they often don't account for key elements of the condition, which include the chronic pain, the acute crises, and the value of continuous treatment. And the one thing I've been noting is this conversation around costs and what cost savings may mean to an individual versus what cost savings may mean to the healthcare system, maybe a provider or um, an insurer for the most part when we talk about cost savings. And so sometimes when we hear cost savings, we're thinking, oh, I can save money. But saving money to the system doesn't necessarily mean cost savings to the individual. And so this is a good place to help educate more, to talk more, to understand more around hearing from patients around what is of value to the patient. And I don't think cost savings per se is of the highest value to the patient. In the community, I think addressing things like chronic pain and acute crises and having access to care is what matters. And there's a way to do that and a way that everyone can achieve their goals. Next slide, please. So funding for sickle cell disease programs, there's a number of programs that are currently funded across the federal government. I mean, it's important to know these programs. We just recently had the approval of the 2026 spending. These funding was held at a steady level. We do anticipate for 2027 that most likely funding for these programs hopefully will remain at a steady level, and that would be our primary asks. Funding for sickle cell disease programs lives inside of the National Institute of Health, also known as the NIH, which supports things like research and clinical trials and innovation. The Center for Disease Control and Prevention has been running a surveillance and public health infrastructure program for some time. This is really about supporting newborn screening and being able to document where there are individuals living with sickle cell disease and better helping to evaluate the care of those individuals within their communities. There's a Health Resource and Service Administration, also known as HRSA, that manages the comprehensive care programs and provider trainings. These provider trainings of immense value. You may have heard of things like ECHO. The importance of these programs is that they help support train providers in the space to better know and understand sickle cell disease, and it creates peer support and learning opportunities that are of immense value. Just lost my slides. Hold on one second. I'll pull them up over here. Um, do we think, do you guys still see the slides, or is it just me that can't see them?
They're not on.
No, I
Okay.
think we lost Dr. Marie.
Dog Marie. Okay. I can keep talking and then we can do it without the slides for now. The other program that are okay, thanks, Melissa. I'll keep going. The other program to mention or part of the department is the Center for Medicare and Medicaid. Inside of the CMS is where we manage programs like the Medicaid program, and CHIP as well. And there's also the CMS Innovation Center that is actively running the cell and gene therapy access model, with sickle cell disease being the primary area of focus. And while there aren't direct sickle cell appropriations in CMS, there are sickle cell related programs that are important to continue to advocate for. And the establishment of the cell and gene therapy access model is a big win inside of the Innovation Center as it relates to the sickle cell community, because it creates an opportunity for individuals to receive access to the new therapies that are on the market, and evaluates financial frameworks for continued access to those therapies. The next slide focuses on legislative priorities, and this may be one that's familiar to many, but maybe new to others, is the Sickle Cell Disease Comprehensive Care Act. And we're excited about this act. We've received a lot of support from it. The importance of this act is that it allows Medicaid programs to establish health homes to provide coordinated care for individuals with sickle cell disease. And this is extremely important. As you know, individuals with sickle cell disease receive care from multiple different providers. And it's important that these providers are able to provide coordinated care in supporting the patient. I oftentimes talk about my most recent experience with the birth of my daughter, and the partnership between my hematologist and my OB in managing my care, and how critical my hematologist was in helping to ensure that a very high risk event that I was experiencing was brought to light across my entire team. And so while I was a part of a integrated medical system, we would want to ensure that that level of coordination can exist across any provider, whether they're a part of the same medical system or not, when it comes to a patient's care. So part of this bill, and Dr. we're on, I believe, slide 9, part of this bill requires that states provide dental and vision services for care. And vision is critically important for individuals with sickle cell disease. I, for example, have SC hemoglobin disease, and we're at much higher risk of retinopathy at a certain phase of our life. And so it's very important to receive vision screening as it impacts our ability to sustain being able to see. And it also for CMS to issue best practices for states on how to design and implement such health homes. And what we know is that different states are trying and implementing different things at different times. And there is an immense opportunity to learn from others. And when we're able to bring those learnings together, we find that we get the best outcomes. And so this bill allows Medicaid to establish health homes and to provide for this coordinated care. And this is something that we need to continue to champion. Next slide, please. So 2026 federal appropriations, as I had mentioned, have been approved. And we are right now at a place where we are focused on, well, sorry, let me say about this. They've been approved, and we're in a partial shutdown for a component of the federal government as it relates to Homeland Security. It's not, so there is a partial shutdown that is occurring. Where we are as far as appropriations is appropriations language is submitted actually this week. By the end of this week, it needs to be in. We are still waiting for the president's budget. We have sensitivity to the spending environment. And so for these reasons, we believe that appropriations for the federal programs that I talked about, the NIH, the CDC, HRSA, we're asking for those funding levels to sustain at their current levels. Sickle is putting in an appropriations language ask to also request a status of where we are with sickle cell related appropriations and programs across the federal government, as well as calling for ongoing coordination between the different entities to support more coordinated resources and care for patients with sickle cell. And we also have the midterms coming up, and these are all elements to be mindful of as far as our environment. Next slide, please. So why does this really matter now? States are beginning to prepare for parsable changes early. And so these may not be changes that are required, but in anticipation, we talked about things like work requirements. We also know that health plans, private insurers are also going to start to respond to some of these anticipated risks. And while things have not been enacted, we may see changes proactively. And so we want to monitor the landscape for where things may have been working well before, and there may be some things that aren't working so well now, or maybe there are some changes that you're experiencing that it doesn't exactly make sense. Um, you may not be the only one experiencing that, or it may be really important to call out because sometimes there's a lot of unintended consequences that happen. And so we want to be able to identify those things and elevate what those challenges are, in the event that there are things that we can help do. And so patients may be experiencing things like additional prior authorizations, narrower formularies, and there may be more coverage reviews and delays. And so, should these be things you're experiencing or people that you support within your community, again, these are things to call out. Next slide, please. So, all of this kind of leads up to Sickle's annual Sickle Cell Disease Policy Forum. This is scheduled to take place March 17th and 18th. This is a virtual event, and this, I believe, is our sixth year. On the first day, you'll hear from speakers, individuals from the Hill, individuals within the sickle cell disease community. There will also be opportunities to prepare how to draft a story, how to talk about ask to your state legislators. And on the 18th, there are scheduled appointments for you to have those conversations directly with your legislators around the importance of sickle cell disease, your lived experience, and the asks that we put forward. Um, I think that is, yes, here's the agenda. Look at that. So it starts around 11. We're taking into account variations in time zone and trying to accommodate everyone. We'll have a keynote address. Um, we'll talk about your voice in the work and how patient advocacy can drive change. We will then go over three key asks. And then there will be a wellness break. And then again, as I mentioned, there'll be the Hill Day trainings. Next slide, please. So my name again is Maia Lang, and I am the Chief Policy Officer for Sickle. This is my contact information and many different ways that you can follow us on all of these social platforms. I'm probably not on half of these, but Sickle is, and please feel free to look them up and connect with them. And with that, I'd like to open the floor up for questions.
Hi, can you put your information back up? Because I didn't get a chance to write it down.
Certainly.
Thank you.
One second.
Thank you so much for that wonderful presentation. I see some people coming off mute. So if you have a question, please feel free to just ask it or put in the chat.
Marjani, this is Paul DeMonico. I had a question for Maya. Can you hear me?
Yes.
Yes,
Okay.
that's correct.
So I really enjoyed your presentation. In the brochure, one of the things I think you mentioned was about engaging in a regulatory way with, I assume, the FDA. Can you tell me a little bit about what you're doing? And I apologize if I missed it. I came in about 5 minutes late.
No, you might be right because when we got over to federal programs, I wanted to talk about FDA, but because we don't have FDA listed on the appropriations list. I didn't talk about FDA, so yes, let's talk about that a little bit. Um, One of the things that we know is that endpoints are a critical part of research and our ability to have supported research. And historically, the requirements around the VOCs have created limitations in the scope or extent of research we're able to conduct and support, which impacts pharmaceutical companies' ability to innovate in this space. And so, I think it's a time to revisit conversations with FDA around endpoints around sickle cell disease and other key stakeholders. I know we just recently connected with the Association for Hematology. We're all kind of in a similar place around the importance of this. And so what we would like to do is have listening sessions this year with the FDA around the needs for the sickle cell community, specifically around the needs to expand the endpoints so that we can ensure that there are therapies or research that is being done and therapies brought to market that are most useful to the community. And we find that the VOCs can sometimes be very limiting.
Okay, that's really useful.
Hmm.
One thing I would encourage us to do, I don't know all the pharmacology behind the various sickle cell disease drugs, but I do know that in a number of the infectious disease areas, we can justify parallelizing, if you will, adult clinical studies with adolescent and pediatric studies, because we understand the pharmacology as a function of weight and body mass. And it would be to the hematology pharmacology experts to weigh in on that. But if something similar exists, meaning we can model pediatric doses as a starting place, we should be parallelizing clinical trials. And the reason why that's important is in the infectious disease space, history shows us that pediatric medicines are often delayed by 10 to 15 years from adults, and our children need these medicines just as much as adults. So maybe it's something we can follow up on.
I'd love to follow up on that. There is some I'm trying to think of. Inside of ARPA-H, I've been taking a look at some of the work that they do, and there's a path that looks at ways that we leverage existing therapies for new reasons or existing pathways to create innovation in other spaces. And so it may be an opportunity to take a look at ways that something that exists might be able to translate into helping in a different way for a different community or for a different use case. Yes, if you could reach out, I'd be happy to follow up.
Yeah, you bet.
It's okay if no one has questions. It makes me feel that maybe the presentation was comprehensive and informative, and hopefully we dropped some good nuggets there. Um, as I mentioned,
Hi, hello, hello, hello.
hi.
This is Dr. Felicia Hunt. I came in at about 5 minutes after two. My question is, besides what the gentleman question was before me, what else for the first 5 minutes did you talk about?
Oh, let me go back in the notes. Probably just hello, my name is, this is the mission of Six Cells. Um, so I talked about who Six Cells is. We talked about the importance of your voice and in speaking to Congress around policymakers.
Mhm.
Um, Let me see. I don't know where you might have jumped in. We talked about potential changes to the Medicaid and funding. And where we may start to see some of the changes as it relates to that. We did get a little bit into the big beautiful bill, really around the work requirements. So that I might have caught you up there.
Yeah,
Okay.
yeah,
Okay.
very good. Thank you.
Stephanie, I see your hand up. I don't know if but yeah.
Hi, Maia. Thanks for the conversation earlier today about working together and then also for this update. Really appreciate it and really exciting to see all of your priorities. I guess my question is just a follow up to some of the things we discussed this morning, that there's so many great advocates out there and so many groups working towards various goals in Washington and with the federal agencies. So, is there a good way or suggestions that you have, in addition to participating in the policy day, that we can make sure that this group can stay in touch and figure out how their groups can help support Sickle's efforts, and also share what they're doing and see how those efforts can be complementary beyond these updates?
Yeah, I mean, in general, I think it's really important for the community to be successful by having coordinated and aligned priorities and the ability to speak to those. And where possible, Six Cells is happy to bring everyone together to facilitate those discussions. Stephanie, I know, share some forums together, but I think that we are touching different stakeholders in different forums. For that purpose, I think there's an opportunity to continue in this forum, to come back, to share with others, to have more of a roundtable format, where we're able to share and others are able to share in a way that we can help to design more of a coordinated priority list strategy and messaging. And I would welcome opportunities like that from other stakeholders in the community. In ways that Six can help pull that together, happy to also talk about that. But in any way that we can show up and meet that goal, we'd be happy to.
That's great. I know the coalition's thought a lot about how to serve as a forum to share best practices both on the state and federal level. So I think um, there's lots of great voices out there, and I think it's wonderful that you're interested in engaging in that. And maybe we can explore with Ivy and Marjani and others from the team managing it to see how we could leverage this forum as well.
That'd be great.
Maya, I had a question about the rural health funds that are flowing and whether there's been any advocacy or policy activity around those funds.
We have an eye to the rural funds. We also are seeing maternal health and the intersections with maternal health as opportunities, not just for funding, but obviously for key areas where we see gaps in the community. Currently, I think we need to, I don't think we've submitted any specific language around care gaps for sickle cell and rural, but I think they're on our priority list for 2027 in ways that we can conduct briefings around them and how individuals living with sickle cell disease in rural America are impacted. And so we have them on our briefing time schedule for this year. And as we get closer to preparing for those briefings, we'll look for ways to who we need to engage and where we need to disseminate. So they are on our radar. Um, they are coming. Right now, we have a very keen eye to policy forum, and then we will quickly start to move on to our federal and state priorities, as well as helping to inform the rural and maternal health priorities or funding.
Thank you.
Yeah, if I may, this is Edward Ivy, Sickle Cell Disease Association of America. I thank you so much for mentioning the Medicaid advisory boards, advisory committees that each state has. I would strongly encourage that we get as many sickle cell patients, sickle cell advocates to join and listen in on some of these Medicaid advisory boards and Medicaid advisory panels. We know that, as you mentioned, the Medicaid changes are going to be implemented in 2027. Perhaps some will be implemented earlier, and we need to have our voice represented as much as possible at that state level. I do fear that there's so much attention paid to the federal level on what's happening with the federal government that we sometimes overlook the impact that state policies can have. So thank you for mentioning that. I was just going to ask one quick question on that. Do you have a way to track like where we have engagements with the different states? Like maybe we can start some type of I don't know some type of registry in terms of sickle cell advocates that are on state Medicaid boards. Just a thought.
I love that idea, Donnell. And thank you for weighing in. And Everyone down in LA are former colleagues, so it's always good to be on a call with them. One of the things that we do is participation in the drug utilization review boards. It's something that Sickle does. We keep an eye to when states are having review of their coverage determinations for Medicaid, and we encourage ambassadors to participate in those conversations. We do keep track of those, and we keep track of the outcomes of those. But Donna, what I'm hearing you say, and I think is also really important, during our policy forum, for example, as individuals will be speaking to their state legislators, there's also opportunities to keep track on the state level of outreach that we're doing directly to Medicaid and their PBMs and other key stakeholders around needs. And that I think is an area of opportunity we can consider. We do have a advocacy map currently on Sickle's website, and maybe we can look for paths to help document and make that more transparent around what work is happening state by state. So thank you for the suggestion, and I'd be happy to follow up on ways that we could get that done. I think I see Julie's hand.
Dr. McConney, did you want to ask your question?
Yes, thank you. So thank you very much, Maya, for your presentation. So I'm Julie McCartney. I'm Sickle in Africa. I also am a member of MARAC, of the Sickle Cell Disease Association of America. So I had 3 questions or comments that we may want to explore. One is engaging with regards to policy discussions with the World Coalition for Sickle Cell Disease. I know Dr. Thompson is on the call and Ash has been actively working on that. So that's one opportunity where we could engage with regards to policy for sickle cell disease at a global level. And then the second aspect is we in Sickle in Africa have been working and organizing policy events with the UN General Assembly in New York. I think that would be another opportunity to start looking at things at global level. And then finally, it's really to explore whether you have had any engagement with the African diaspora or Caribbean diaspora in the US, because this is a growing group. We have the Africa Diaspora Network, and they're particularly interested in engaging with policy, investment, as well as conditions that are specific for people of African ancestry. So those are the 3 questions, comments, or opportunities that we may want to explore. Thanks, Maya.
I appreciate you bringing them to our attention. The global landscape is of interest to us and is actively a part of areas that we're looking to expand. I know that our president, Ashley Valentine, is participating in more of the global conversations, particularly with expansion into Africa. There's a couple of key countries that we've been focused on, but happy to have additional conversations. I just received a notification around policy gaps even in Canada that I thought were particularly interesting because to some extent they are very similar to challenges that we're having here in the States. And so I think these global conversations would be helpful for us all to learn from. And if we could get to merely a global policy framework, it would also help around innovation in the space as well. And certainly we know that investments in the US can help benefit individuals in other countries. And so I think we would be happy to show up in the conversations you mentioned. My father is from Jamaica. I always highlight the longitudinal work that Jamaica has done around sickle cell disease, and also see this as a framework that should be referenced a little bit more often when we're thinking about ways that we can look at the long-term impacts of sickle cell disease here in this country. So I'd welcome the opportunity to connect with others. And if we could also follow up on the names that you suggested, I'd be happy to talk to them.
Practical question, and I'm glad that Dr. Ivy is here. Should this be done through SCDC? Should it be done through SCDAA, or should it be done through Sickle?
I think we all are aligned as far as it relates to the needs for sickle cell, and we're happy to partner. I don't, I don't know if it needs to be done specifically through one organization or the other. Maybe we should all be a part of the conversation. But I think when it comes to the policy, I'd be very interested in showing up. But welcome SCDAA and the coalition and everyone to be a part of that conversation.
Yeah, and I would agree with exactly what Maya said, that we don't have to say which group. We can all be a part of it. I think we all are in sort of different lanes. Six Cells is more of in that legislative and policy lane. SCDAA tends to be more in that the community-based organization providing education around sickle cell disease. And ASH, of course, represents the hematology community. All three are very important, and then particularly as we look internationally, we can all play a role, as well as other organizations. The ones I just mentioned are USA dominant, but we do have to recognize that there are other global players as well. I believe there is a person on this call that works closely with the Plan Plus. I think he's with the I'm sorry, I don't want to say which foundation. Paul, I believe it is, and he's working on the international stage as well. So we don't want to limit ourselves. We all want to make sure that we're working together. I do think communication is very important. You know, for the past year, Dr. McConney, the U.S. has had its difficulties, as you know, that I've talked about some. And so, I know with SCDAA, we kind of had to shift to maybe really focusing in on the U.S. because of what was happening. And then, there is elements of it that we just have to keep our foot on the gas in the U.S. in terms of educating the population about the changes to Medicaid. We didn't mention it in this call as far as I remember, but there's also the gene therapies and making sure that individuals are getting access to that. And then you have other issues around Social Security disability criteria that we haven't discussed. But we should still keep an eye on what can we do on the international stage in helping the rollout of the hub and spoke model. Maya mentioned Project Echo, and how can we use that to really make sure that not only in the US, but also globally, we're looking at how do we get resources that are very limited into communities that need them, and having that hub and spoke model, having where hematologists are working with primary care providers. So I think it's all of the above approach that we have to take, and SCDAA stands ready to partner with any organization.
I thought I saw another hand. Thank you, Darnell.
Yes, thank you, Dr. Ivy. Dr. Thompson, did you have anything to share?
You're on mute if you're talking. Oh, I'm sorry.
No, it was really just to say that that Dr. McConney has brought up some other key collaborations, and in some ways it does speak to why this coalition exists in terms of it being a town square where there really is an opportunity for as many people who come to sickle cell with different vantage points, but that there definitely is the importance of us identifying who's doing what so that we can look for opportunities for synergy. I would say that, just to call out the World Sickle Cell Coalition's intent is to really look at really looking at low and middle income countries, so sickle cell in the developing world. And so much of its focus, much of its activities really are ex-US. And so by design, yet there are substantial numbers of people who are very much involved in the coalition who are based in the US. And so it's recognizing that, but yet it certainly would be very important for us to take advantage of the opportunities to collaborate with as many people as possible. I would also point out that, we talk about these differences, and Donnell, you brought up several of the other additional policy issues that are related to primarily people in North America or in the United States. But yet I think the realities are that the lived experience for many Americans with sickle cell is not terribly different than sickle cell patients in the developing world. So I think that even as we talk about the mechanisms for having an impact from an advocacy perspective, it's remarkable how disenfranchised, how fragile the connections are for many sickle cell patients in the United States with the American system for all kinds of reasons that I think many of this call are well aware of. And so when we look at sort of the opportunities, even if there are going to be differences in terms of who's at the table from a policy perspective, I think we need to acknowledge that at the patient level, there really are some phenomenal opportunities to look for how do we actually address some of the challenges that patients and their families are experiencing.
Yeah, and I also want to call out there is that I recently had a conversation and it's the Latin community is deeply impacted. I was speaking with a young woman and she was talking about the challenges, in DR. And so, there's as you're highlighting, these challenges are not just based in the US. These are global. The opportunities actually to share what it is that we're doing here in the US and to come together on a universal front across globally, then creates more power in the conversation. And oftentimes in the US, when we talk about this condition, we talk about it being a relatively small community as far as 100,000, but we know that globally, this is a condition that's deeply impacting people. And so I agree that we need to continue to look on a global front. And I see a hand, Andrew.
I just a comment on the global, but then I do have a question for you more on the US side. I just want to share with everyone and be happy to debrief afterwards. Just an example is upcoming at the end of March is the International Maternal, Neonatal, and Child Health Conference, IMNCH, in Nairobi. The World Health Organization is partnering with ASH and a few other organizations to host a side event really dedicated towards newborn screening. And we have Charles Kiaga from Uganda, who will be presenting on the Ministries of Health plan to do a universal screening program throughout the whole country and their plans to level up. So I think it's great that we have such great interest. And I think there's such great chances for alignment, especially as we have now partners like the World Health Organization, UNICEF, and others who are very interested in hearing what our kind of shared voice and shared perspective is. But I'd be happy to debrief everyone. I'll be there in Nairobi at the end of the month and happy to debrief afterwards. But question for you, Maya, is I know a lot of focus was on national level policy, but as we know, all policy is local. And I'm thinking, I live in DC, we've got mayor elections coming up, we've got local policy and changes happening, and across the country, midterms are happening,
Yep.
and as well as other local decisions. I was curious how Six Cells is working on local advocacy, both at the state level and even maybe drilling down deeper at more maybe high burden areas of the country, just kind of what policy is done at the more local level to support people with sickle cell disease.
Yeah. So as I mentioned, I joined the organization in August, and so we have a very aggressive agenda to get our hands into policy, both on the federal and the state level, and to get involved in these conversations. One of the things we're currently doing, as I mentioned, is conducting the landscape analysis, again, on a very focal point in the Northeast and the Mid-Atlantic to do that deep dive on what does it look like at the state level. But one of the core areas of focus for Six Cells is the advocacy component through our ambassador program. And where we intend to take next steps is by understanding where these gaps are. Our policy forum in Hill Day is on the federal level, but the next steps is how do we start to upskill ambassadors to be engaged at the state level for just that reason. And so we want to be able to provide them with what's the current landscape within your state? How do you engage directly with your state legislators around that local policy and to your local legislators around changes that you need to see within your community? In some cases, they're actually a lot more accessible than people know and understand. So that is on our roadmap of activities. We do have something called PTMs that we do to help educate and train individuals around how to do some of this advocacy work. And I just sent a note, I think, to Melissa and Dogma maybe like just a few weeks ago around us putting on the agenda advocacy at the state level specifically to start talking to individuals about how to do that. And I'm seeing it in some places. Florida just happened. There was changes in their policy around education for sickle cell disease for providers. We're seeing it in Connecticut as it relates to coverage for the cell and gene therapy. So we're seeing it happen. Six Cells has a national footprint. We engage with individuals across states. Again, we are not organization based, so we're happy to work with anyone who's interested in advocating to decision makers. And so we do look for areas, for example, this year's policy forum to prioritize where we may not be seeing as much activity from a particular state and doing more direct outreach to say, hey, we'd like to get you a little bit more involved in elevating your voice. And so we do work on some of that hot spotting, as you mentioned as well. And lastly, what I want to say, Andrew, as you talk about the importance of newborn screening, maternal health with sickle cell, because I just had a child, I will not stop here. There is a very urgent need around sickle cell disease and maternal health, particularly around the role of the hematologist and the OB. And there are key risks baked into pregnancy for individuals with sickle cell disease that we're not spending enough attention on. So as these conversations are happening, newborn screening is wonderful. The maternal health is really important because the baby can't get here if the mother doesn't. So I just want to put that there.
No, appreciate that. And just want to share, I know Ash is definitely very dedicated to that topic as well. And we do have guidelines that are going to be developed on sickle cell disease and pregnancy. We are currently developing the committee and so forth. So that's a little ways away, but I
Think
fully
of
agree with
me
you.
when you
Yes,
get to that committee.
I
Thank
know
you.
that's definitely a very important priority of Ash too. So thank you for that.
I had a question. Excuse me. I was listening, and I haven't heard too much about transitioning. So I know we heard a lot about what you mentioned as far as maternity and newborn screening, but the transition post-COVID looks so different. From my experience, I'm a caregiver of a warrior, and it has been extremely difficult here in the state of California because I am in California. And here it's Medi-Cal, so some of the terms are a little bit different. So I have to remember the differences between the two. But my question is, what does it look like as far as transitional? And where do people start thinking about their transitioning now that we're like post-COVID, because it's very difficult to get the comprehensive care outside of pediatric care, because our pediatric care system here in California, it's very comprehensive. Everything is together. So you have the comprehensive care in pediatric level, but it doesn't exist in adult care. And that transition after COVID has been such a puzzle to put together. Is there anything that's being done regarding transitional care?
A few years ago when we worked on this with the NASM report, we looked primarily at transitions of care from pediatric to adulthood. And what you're highlighting is that there's been some significant events since we last took a deep dive into that. And I can appreciate you calling out the transitions post-COVID and what that looks like, where we may have had telehealth, where we had automatic approvals on Medicaid, and the whole landscape is changing around what you need to do. And I see Darnell nodding as well. When I think about it, I don't feel that we've had a lot of specific conversations around transitioning post-COVID around coordination of care, where there may have been a lot of resources available that just don't exist anymore. And what I will say is um, this level of coverage, when you talk about Medi-Cal, obviously a Medicaid product, but these vary state by state. Medicaid varies state by state. So these requirements around when people are transitioning, at what age, what coverage, what's available is different in California than it is in New York, and so we don't have a keen eye, at least I don't, to what those direct impacts post-COVID on transitions of care look like. I don't know if anyone else on the conversation does, but I just want to call out that I do not. However, we do have a keen eye to what coverage looks like and to how the impacts to Medicaid funding are starting to evolve at the state level. But I'd kind of open the floor up a little to others that maybe, or I just, I don't think there's been an explicit focus.
So I think one of the challenges to transition in the post-COVID era has been we have, we're having more trouble getting people to come to clinic appointments in general in both adult and pediatric spaces. I think when we went to all virtual and we decreased in-person visits, that people just started coming less, and it's been hard to get people back into that routine. And there's been at least some work done in transition assessment and other activities through virtual visits or outside of the visits, which I think can help with that. But as a provider, I think that there are advantages to virtual visits and accessibility that are really tremendous, but there also are challenges that come to it, especially around care coordination and multidisciplinary care.
A question, do you think a community-based program can help fill in that gap to help these people that's having challenges to understand the importance to coming inside versus virtual? What can be virtual versus what doesn't need? Because there are tests that has to be done that needs to be in person, a TCD, blood work, or whatever to ensure to minimize strokes, other things and complication, long-term damage that are done over the organs over the long period of time. With me having a child that went through transition during COVID. So she turned 18 in 2020. So we went through this and still currently is going through since COVID. And it just seemed like the coordination is just like night and day. I don't know how it looked on a pediatric level because we literally got kicked out of the pediatric level during COVID. And trying to put the pieces back together has been very difficult because the doctors are stating something like, oh, we are not qualified, but they're orthopedics to ensure that she's still getting the appropriate care at an adult level, and they're still giving her the same treatment as a pediatric. And nothing is working because nothing have evolved over time because they're still treating her and her meds as a pediatric patient and not where she's currently at today. And that has been, a true fight. So I was just curious on where is the conversation for transition to ensure that up and coming pediatric patients are getting that and the parents are getting that education prior to or around 16, 12 years old, way before the time for them to transition based off the experience that I had during COVID.
So I think a lot of programs start their transition process in peds at around 13. So there are a lot of places that start early. We find that one of the challenges we have is that adolescents, particularly ones that are doing pretty well with their sickle cell disease, sometimes drop out of care when they get to late teenage before transition. And if someone's not coming to pediatric clinic, we have a lot of trouble getting them to show up for adult clinic. So I think that's one challenge. The challenge I'm hearing from you, I think, is a little different where sometimes it's lack of experience or coordinated care on the adult program, and that can be more adult program specific. In general, in adult care, people get less care coordination than in peds. It's just, adults get treated like adults, and that's very different across disease states, where the amount of follow-up when people don't show up and things like that is generally less.
Yeah, and I just want to quickly say that yes, to your answer, to your question about are there community-based organizations? I know there are community-based organizations in California that can help you with it. One thing I just wanted to say, is that as we were discussing earlier, there are programs that are currently in existence that should work effectively. So, I don't know if you're aware, but the Sickle Cell Disease Treatment Demonstration Program was just reauthorized for $8.5 million, and it creates the Sickle Cell Disease Treatment Demonstration Programs, which has these centers that are really trying to build networks. The Sickle Cell Disease Newborn Screening Program, when I was at HRSA previously, it worked on really helping community-based organizations be there to deliver to the communities. You have Sickle here, which is trying to work with ASH and others, the American Society of Hematology and others. And so I think what we have to do is really make sure that we're helping our communities understand how to leverage these resources, particularly because if we don't leverage them, then they do have the chance that they could not be there in the future. So I would encourage you to use your community-based organizations. The Sickle Cell Disease Sickle Cell Disease Association of America has 57 community-based organizations. I think there are at least 3 or 4 in California that we work with. But also, we have to look beyond the medical aspect of this. Transition is a very complex, and I'm saying this as a sickle cell patient that's also a doctor. Transitioning is a very, tedious process that's not just medical, it's also social, it's also educational. We have to look at, are we getting our students into IEPs, individualized education plans, so that they get the necessary resources they have in schools? How are we engaging the schools to really help with that academic performance evaluation so that students don't get to high school or beyond and they're not ready in terms of academically. And that then doesn't prepare them for a good career. And then where does that lead them? Particularly as we're starting to hear about AI and the rupture is going to cause in terms of the workplace. So in my opinion, as the patient, I'm talking now as the patient, we have to look beyond the medical part when we talk about transition.
True.
And we have to leverage those resources, the community-based organizations we have, the legislative advocacy we have, the hematologists that are wanting to work to make sure that patients get that follow-up. How do we make sure that all of this works together? I think is very important.
True, and I really appreciate that. My main issue that I found was working with social workers to get the community help because they didn't know nothing. It was like I had to go and find it and be away from the care of my daughter, which played a vital role because I was able to find certain organizations. But because I live in an area that is not primarily us, it's not as active. But my main issue was the social worker because they act like they don't know anything. So the connection to the community, to the hospital, to the social worker is very vital, regardless on where the hospital is at, especially in places that we're not dominant. I'm in Orange County. It's not a lot of us here. So when I was trying to find community connection, I couldn't get it. I couldn't find my people. It's like I find it and then no callback, no answer, no nothing. So here I am, a young mother, frustrated, going through a lot. I went through hell and high water. I got criminalized for my child. I had to go to court for 2.5 years. I went to jail behind her sickle cell. So at the end of the day, there was no community connection for me for the past 13 years. So it was hard being in an environment when I am yelling and nobody hears me. That was the frustration as a parent outside of an advocate. But I was in the trenches. My child spent over 200 days in a year doing COVID because I did not know what to do, did not want her to get discharged because I didn't want her to die. But because I didn't have any kind of community connection, nobody knew where to go to at the hospital as far as the social worker, it was a lost thing for me. So I was just fortunate enough because I was smart enough to go outside of the community to find the services, but it was hurtful, very hurtful on what I experienced, my personal experience. I was left hanging to dry to fend for myself with nothing. So yes, I truly understand, but the ones that are in the rural areas, one that comes from areas that are predominantly Caucasian need the support more, if ever, because they don't see us. And then when you do finally see us, it's the connection sometimes is not there, or they're trying it up against the battle. I was just thankful that I was able to look beyond. But to be honest with you, if you're not connecting with the ones that are inside areas that really need the help, I got lost. And I'm just thankful that I didn't take my own self away with the disconnect of my community.
Yeah.
Sheree, I just want to thank you for sharing your experience, and I understand how challenging it is, and I think we're happy that you're on this call, and there's a lot of resources here, and you're in good hands, and so I hope you at least now know who you can reach out to. We're all pretty well networked with each other, and so when there's needs, we can help to find solutions, and the system is not perfect. It's why we're doing this work.
Not perfect,
And
but
there are a lot of gaps. Yep. And
I'm in a
so,
position that's different, but we're talking about 10 years ago. A 10-year-old person, me, you know what I'm saying? Now I did create the community. I created it then, but what I'm saying, my community did not consist of sickle cell. That's the thing that I'm saying. It's not that I didn't create the community, but I had to look beyond and take away the sickle cell component to get it. Because leading with sickle cell was not getting me ahead. But when I led with other things that people could connect with here in my community, I was able to move ahead. I was able to get the services. But when you go through it during COVID, when you're getting kicked out and there's nothing going on, it put these particular pediatric patients in a different type of situation that it would have been a year or two prior. So now everything is a learning thing for these particular individuals that graduated in 2020. She graduated in 2020. She was 18 throughout her last part of high school. So it wasn't as if she was in COVID in her senior year and we still had time to transition out pre-COVID. That wasn't the thing. So it was really difficult, you know, when you're trying to find community and you want your community to look like you, but there's no access point from social workers. You guys have to be inside the network with these social workers so they can be able to contact you when things arise because they don't know that you exist. So if the social worker has a family that needs help and support and they don't know that you exist, how can that family find community? They may be new to the area. They probably moved from LA. So it just makes it a challenge when you are trying to get it and they don't know. So that's what I was saying.
And you're making great, excellent points. You know, I guess what I was trying to say is that, you know, we want to try to leverage. So through, you know, there's now the National Alliance for Sickle Cell Centers, and I believe there's over 110 centers. Those are the providers that are trying to create the networks. As I mentioned earlier, SCDAA has community-based organizations we work with, but we always looking to expand and to reach those communities that you're talking about. But I would want to close, and I know we're at end by saying, you know, the old proverb, you know, each one reach one, teach one. You've learned a lot through your experience. You know, hopefully you can use that to help other individuals to show that, hey, you know, and I think thought it was said in the chat that you need to get your story out. We need to hear more stories like yours, and we need your help in helping those individuals in those rural communities. There's no federal agency that's going to be able to do it all. We got to figure out how we work with the federal, the state, and even the local, you know, down to the community, the county levels. How do we build that infrastructure? And it's going to take all of us. So I'll stop there. I know we're at the end.
I appreciate you guys listening to me. I apologize for my rant, but I just noticed the gap based off of what I've experienced and what she's currently going through. So and because it's so complex, I can just see, you know, the different gaps and doctors just dropping off, have an appointment, and then all of a sudden we're not qualified to take care of her, you know? So it's those things. And when I appreciate being here in California because we do have certain programs and stuff here that other states don't, which I pray that other states will hopefully start implementing and doing things like this can bring more awareness. And I am working on a book. I am working on different aspects. So hopefully I'll be able to partner up with you guys. We are doing a ask here in California. I am currently the Orange County Advocacy Day coordinator here in Orange County. So I hope you guys, we can see you out here, and that's happening in April. So I'll hopefully put in the information in the chat. We are really super excited. It's for Cayenne Wellness, a community-based organization. So we want more funding, and we're asking for the doctors to be more accountable so they can actually follow the regulatory things that are already exist here in California. So we are doing some state things here, but I'm also working on community-based things to get people to understand the importance of sickle cell and gene therapy and the funding that is needed post and during gene therapy to make sure the parents are supported throughout that process. So that's kind of a little bit about myself. So
Thank you.
Thank you for that. We are over time. I really appreciate everyone coming out today. And we appreciate you, Maia Lang, for walking us through this important conversation. And if you have any questions, feel free to email us. There's some important things in the chat popping up. I'll keep the chat open for you, Cherie, to add your information. And this recording will be up on our YouTube channel. And we appreciate you all for coming out once again. Thank you all.
Thank you.
Thank you.
thank you for so much for the opportunity to speak. I apologize if I was super long-winded. I get very emotional when it comes to things like this, but I really appreciate the time that you took, and it was very informative. So I really appreciate it.
Please don't apologize. We appreciate you sharing that information with us. And
Well,
hopefully we'll be able to connect you with some. I see someone put Cayenne Wellness Center. That's what I was going to add and send to you
yes,
separately. So
yes,
hopefully we'll get you continue connecting with others in the
if I want to
community.
work on my ask, and I know it wasn't a lot around the ask or anything like that, it was really a brief overview of a lot of things. And me working on my ask and went through a lot. Like I said, I didn't really go into details, but I really was criminalized for caring for my daughter. And I spent 2.5 years fighting for truancy charges that was brought against me because she was in the hospital so
Mhm.
much. And they did not believe that my daughter was that sick for whatever reason. So it's very important because I don't want any other parent to feel criminalized for caring for their child and trying to make sure I had a 504, had an IEP. I was doing the things and still fell through whatever cracks. So it's very important to me, the educational component to the parents, especially if they hear it from another caregiver, because I don't know if they truly understand the impact of
Yeah.
caring for a child with sickle cell.
No, we really appreciate you sharing your story. We we're gonna follow up with you because we need to get you connected with some other. We need to get the information you have, and that's
Really?
important. Yes.
I
Um,
put my email up so you can email me. So my email is right there. It's first and
absolutely.
last name at gmail.com. So super easy. um, and I'm going to register for you guys virtual for the federal level for
Oh,
that.
the Six Sales Policy Forum. Yes, please do.
Yes, so I'm going to be registering for that. And then yeah, because I would love to be able to connect and be able to help as much as I can. So I'm really
Yeah.
excited to be able to connect it. Whatever you want to know, write your questions down, get them ready. And I think it's also important because I do live in California to make it a point that it is a difference in every state. You know what I mean? Because like they have programs